everyone. My name is Mithu Maheswaranathan. I am a rheumatologist at Duke University Health. I completed my fellowship in 2018, so I've been working here since that time. I'm currently a member of the Duke Lupus Clinic, so I see patients with systemic lupus once a week and also general rheumatology clinics. My academic interests include patient-physician communication, health literacy, as well as medical education. So I have some roles in the School of Medicine and an interest in digital medical education as well. I think it's a good question. We definitely have some challenges in treating lupus in our clinics. So first, there's some limited therapies within our treatment armamentarium at this time, especially when you think about steroid-sparing medications to mitigate the effects of prednisone use that have a lot of long-term side effects. And then there are also social determinants of health that can negatively impact our patient and their ability to successfully manage their disease. So these can include things like socioeconomic inequities, challenges with access to care, medication adherence, health literacy, and all of these factors ultimately impact their disease activity and health outcomes. And I think as rheumatologists, we're becoming more aware of the impact of, social determinants of health, the downstream consequences of systemic racism and how that impacts racial disparities and outcomes in care. And so I think going forward, we're going to create more novel ways of trying to intervene regarding these social determinants of health. There are also some ongoing clinical trials looking at new biologics in SLE with different mechanisms of action. So back in 2011, belimumab was the first FDA-approved therapy in 50 years in SLE. And in the last couple of years, there have been a few new studies that have come out, one looking at a new indication for belimumab, specifically for lupus nephritis, so an approval for that indication, as well as the biologic anifrolumab. So there have been a few new therapies, and this past year, there was a post hoc analysis of the NOBILITY trial looking at obinutuzumab, so a novel mechanism of anti-CD20 therapy in lupus that was looked at in combination with standard of care for lupus nephritis. So I think in the future, there's hopefully going to be, future new therapeutics that target different pathways of the immune system that we can use in SLE. So those are kind of the two pathways I'm most looking forward to. I would say some of the trends that we've seen is a further exploration of steroid-sparing therapies for a lot of our different rheumatic diseases. It's a huge need. Some conditions have not had a lot of novel, agents that have come out. So in 2023, we saw for polymyalgia rheumatica, the first FDA-approved therapy, which was sarilumab for refractory PMR. And I think as we go forward, hopefully we'll create novel mechanisms and novel drugs for different rheumatic diseases. So that's something that I think we'll see more of in the future. Another interesting trend that I think we saw in 2023 was the explosion of digital medical education. I think this really started in the pandemic especially, but it's been further accelerated in rheumatology. I think there are a lot of novel people in this space. So we saw a lot of conference coverage at ACR Convergence this year, use of tutorials to summarize content from different talks, podcasts, video coverage like Room Now, and then tremendous growth of some of the physician networks like the Q&A based platform, the MedNet. And I think it's interesting to see where this goes in the future. There's been a very big interest, tremendous growth in sort of exploration of telemedicine, especially in rheumatology. During the pandemic, we saw, of course, a huge uptake in use of telemedicine. There has been a telemedicine center that has really explored providing access to rheumatology care in more rural communities in a lot of different academic medical centers, including the University of Pittsburgh, that has really modeled that sort of access to care through telerheumatology. And then one of my colleagues at Duke, Dr. David Leverance, has explored a model of trying to identify the patients that are best suited for telemedicine or most optimal for telemedicine by creating this model and having providers that see these patients sort of rank how effective that particular visit was as in-person versus telemedicine. And there have also been a lot of individuals that have explored how we can create telemedicine and telehealth curriculum for teaching ways of utilizing telemedicine more effectively in clinical care. So thinking about how do we teach our fellows about telerheumatology. In terms of artificial intelligence and AI in rheum, I think there's a big need for further exploration, but a huge potential for this. So when we think about using AI for diagnostic dilemmas, for creating some initial drafts of materials, or automating our clinical tasks that we have to do every day in practice that are burdensome, these are all areas that I see using AI. So hopefully there are people that are interested in sort of exploring this in the rheumatology realm. Yeah, something I'm looking forward to seeing more of, hopefully, is the exploration of sort of the efficacy and safety of CAR T cell therapy. So this is chimeric antigen receptor T cell therapies that can target overactive immune system cells, help reestablish immune tolerance. And there was a study that was near the tail end of 2022 looking at CAR T cell therapy in a few patients with refractory lupus. And now this has been explored in a few other conditions in rheumatology, including scleroderma and myositis, with some mixed results. But I think it's going to be interesting to see, can we identify some more targeted therapy to try to look at more specific target antigens in rheumatology with potentially less side effects than some of the current biologics. There's a lot that we still don't know about CAR T cell therapy, but I'm looking forward to seeing the exploration in the future of CAR T and potential other novel ways of targeting the immune system.